Welcome to everybody. Welcome you today. My name is Marty Mascari. I'm a contractor with the North Central Texas Area Agency on Aging and the Aging and Disability Resource Center. And we're funded today through, partially funded through monies from HHSC to provide webinars. And we welcome you to join us. These webinars are free of charge. And our target audience, just so you know, is family members caring for their loved ones, but we're also anybody and everybody, professionals, everybody's invited. So we want to talk next about CEUs. If you will advance, Doni. So today we're offering 1 hour's CEU credits for both licensed professional counselors and licensed social workers in the state of Texas. Those of you that live outside of Texas, many times we've mailed these certificates out. People have told us they work for them, but there's no guarantee that just depends on the entity that's overseeing your CEUs and whether they're willing to accept that or not. But I have had a lot of people come back and say they were able to do that. Just so you know, you need to complete the entire live webinar in order to be eligible. And you must complete the Google survey evaluation that we'll send out once we're done with today's webinar. You should get it about 30 minutes to an hour after we're done today. The Google survey link will be up until 5 o'clock Central Time, 5 p.m. Central Time on Friday the 1st. And then we'll have all the certificates out to you all by the 8th, which is next Friday. If you get to the point after that and you haven't got your certificate, please email me. Sometimes wires get crossed and that kind of thing, and we do want to make sure we get you your certificates, but it does take a little bit of time to get them out. So if you would give us till next Friday, and we'll get those out. The next thing I want to cover is Q&A, questions and answers. Because of the number of people we're expecting on today, we aren't going to be unmuting anybody to ask questions live. You're automatically muted as you join us. And so if we're going to ask you to use either the Q&A or the chat functions on your computer to type in your questions, and I'll be trying to type in some of the answers that I know the answers to along the way, but at the end, we'll try to answer live as many of them as we can before we get done. So Doni, I'm going to introduce to you our speaker. Doni Green is the Director of Aging Programs for the North Central Texas Area Agency on Aging and the Aging and Disability Resource Center. I should know that by now. I've worked under Doni for about 12 years now, but obviously I went brain dead there for a minute. So Doni, thanks for being here, and we look forward to hearing what you have to say.
Thank you, Marty. I really appreciate you pulling this together. And this webinar had an interesting evolution. So one of our home delivered meal providers reached out and said, I'd really like to know more about the services that you all provide. And I said, you know, I'll be happy to walk you through it, but let's see if anybody else might be interested in joining in the conversation. So I had reached out to Marty thinking that maybe we could go from one person to maybe 10 or 20. And I'm delighted to have the opportunity to talk with you all. One of the many challenges that I face is, you know, we are a not-for-profit agency. We have no advertising budget. And so most of our referrals are generated through our partners and through word of mouth. So what I'm going to do is talk about 2 different programs this afternoon through the Area Agencies on Aging or the AAAs. Then I'll turn to the Aging and Disability Resource Centers or ADRCs. As I'll share in greater detail, these services are available in all parts of Texas, and in some cases throughout the entire nation, but the specific services may vary a little bit from one region to another. So as I go through the information, I'll try to let you all know which of these services would be available statewide and which ones may be specific to the 14 county area that I serve. So I would like to start by talking about the coverage areas for both of these programs. Again, starting with the area agencies on aging, or AAAs, and the AAAs form a network that cover the entire country and also Puerto Rico. There are over 600 throughout the nation. There are 28 in the state of Texas. And with the AAAs, some of the services have to be provided by all AAAs. In other cases, a AAA can choose to support a service based on regional needs. So again, I'll be making a discrimination as I talk about AAA services between those services that are available throughout the entirety of the state and those services that may be more specific to the North Central Texas region. Then I will turn to a discussion of Aging and Disability Resource Centers, or ADRCs. They do cover the entire state. And of all the services that I'll be discussing with you, they are available through each one of those 28 ADRCs. So let's start by talking about eligibility for services through the area agencies on aging. And these programs are supported at the national level by U.S. Health and Human Services and the Administration for Community Living. They're also supported at the state level by Texas Health and Human Services, but the programs are significantly different from many of the programs funded by Texas Health and Human Services Commission, which is the agency that administers the Medicaid program, as well as many others. And that difference is that eligibility for the area agency on aging services is determined by age rather than income or resources. However, the legislation that created the AAAs, the Older Americans Act, also requires that programs target people who are at risk of adverse outcomes. And there's certain populations that are at greater risk of those adverse outcomes. They do include people who have low incomes. So one of our obligations is to come up with strategies so that we're reaching people with low incomes to let them know that these services are available. We also target those who are frail. And typically we define that as requiring help with at least 2 activities of daily living, things like bathing, dressing, grooming, toileting, feeding, or somebody who may require substantial supervision because of Alzheimer's or other types of cognitive impairments. We also target those who are isolated and those who are at risk of premature institutionalization. So with some of our programs, in order to determine eligibility, all we need to know is that a caller, a potential client, is at least 60 years of age, which is generally the age of eligibility. But for some programs, they may have additional eligibility requirements. For example, we'll talk about our care coordination program and our home delivered meal programs. Those may require that folks have functional impairment or may be at risk of nursing home placement. But again, it's important to keep in mind that in most cases, eligibility is on the basis of age. So in terms of the cost of AAA services, all programs are provided at no charge to those who qualify. However, we and our providers can accept voluntary contributions. So if folks want to contribute a few dollars towards the home delivered meals that are funded through our agency or the care coordination services, we will accept those contributions, and we have to provide assurances that that any contributions go right back to the service under which that contribution is made. So if somebody sends us a check, it's not as if we get a really nice lunch that day. It just means that we're able to put some funds back in the meal program, the residential repair program, and so on. So now I would like to give you a sense of the 14 counties that I serve. And again, in the materials this afternoon, I'll be making reference to a few services that are somewhat unique to our 14 county area. So although we are based in Arlington, we don't serve Tarrant or Dallas counties, but we do serve the 14 counties that surround those two urban counties. Each county, Tarrant and Dallas, has its own area agency on aging, but the needs in those counties tend to be pretty different from the counties in our 14 county service area. So if you are from another part of Texas, or if you're in the heart of the Metroplex, again, just keep in mind that there are area agency on aging, there are aging and disability resource centers that are available to you, but they may look a little bit different from the services as I described them. So there are two different ways that we provide services through the area agencies on aging. One is directly, so we have staff and volunteers who work out of our office in Arlington, out of their homes, in order to serve older adults and family caregivers throughout our 14 county area. The other way that we provide services is through local partners, either contractors or subrecipients. And so the direct services that I'll be discussing are benefits counseling, care coordination, caregiver support coordination, long-term care ombudsman. And I'm going to give you more detail on all of those programs. And of those 4 programs, the benefits counseling, care coordination, long-term care ombudsman program are services that are required for all area agencies on aging in the state of Texas. So all of these will be available in your community if you're caring for somebody or working in the state of Texas. The caregiver support coordination program is not required by the state, but the vast majority of us, and perhaps all of us, do offer that program. The PEARLS program, I've highlighted that in red. That is pretty specific to the North Central Texas area. And that is a program that is available in the 14 counties that we serve, as well as Dallas and Tarrant counties. If you're from another part of the state, you may not be able to access the program locally. And PEARLS is a great program for folks who are dealing with depression, loneliness, isolation. If you all have been following the research, COVID has had a devastating impact on our sense of social connections and our mental health. And we've seen a significant increase in the incidence of depression, anxiety, feelings of isolation. Then the contract services that I'll be talking about include congregate and home delivered meals. And one of the things that's important for you all to know, if you have requested home delivered meals in the past and been told that, that the person has to qualify because of a disability, in normal circumstances, that is true. But during the public health emergency, our national agency has waived that requirement, so that if there is somebody age 60 and over who is not disabled, but is sheltering in place, having difficulty shopping, may need the home delivered meal program, that person can be considered and deemed eligible as long as the public health emergency is in effect. When that public health declaration expires, then folks would have to require some kind of assistance with shopping, with meal preparation, in order to qualify for the home delivered meals. But as I mentioned earlier, there are no income requirements. So Ross Perot's mother could qualify for home delivered meals if she's at least 60 years of age and request the service. We also work through local partners to support transportation services, and that is a service that the Area Agency on Aging can choose to fund. Most of us do choose to support transportation services, but not all. Congregate and home delivered meals, on the other hand, that is a required service for area agencies on aging, and those services would be available in all parts of Texas, assuming that there are local providers. In some very small communities, there may not be a senior center or another congregate meal site. So transportation, the transportation that we support is scheduled in advance. It provides curb-to-curb assistance, and unfortunately, it is limited to transportation within county boundaries. Recently, we've launched a pilot program in a couple of our rural counties to pay for out-of-county transportation for those residents who need to cross over those county boundaries in order to receive essential healthcare services. So that pilot is going really well. We're interested in expanding that, but transportation tends to be the social service need where there's the greatest gap between services and the demand for services. So we often struggle with those transportation issues. We are required to provide information referral and assistance. So that is another service that would be available in all parts of Texas. We also work with local partners to provide instruction and training services, which are similar to this afternoon's webinar, where we have subrecipients who will schedule trainings on various topics of interest to older adults and those who care for older adults. Today's program is part of our caregiver information services, and we rely on local partners like Marty Mascari, the Alzheimer's Association, and then we also choose to support caregiver education and training. So all of these services we have supported as optional services that we think are really important. Not necessarily all area agencies on aging would have comparable services. A few other initiatives that we support, and these are more specific to North Central Texas. We have a Home by Choice nursing home relocation program, and that program helps nursing home residents who have been approved for Medicaid benefits and are assigned to managed care organizations. The program helps those residents in relocating to the community. So we have relocation specialists, both staff and contractors, who will help residents find housing, arrange community-based services, access transition grants that will pay for security deposits and rental deposits and pots and pans and essential furnishings and so on. We also support a number of preventive health workshops where we will bring together small groups of people, either live or remotely. All of these programs are available through Zoom. Some of them are available to folks who choose to participate by phone only. And the programs that we're sponsoring right now include A Matter of Balance. That's an 8-week series of workshops that helps people learn how to prevent falls, how to overcome fear of falls, It is not unique to North Central Texas, but it's not necessarily available in all parts of Texas. And then we also sponsor chronic disease self-management workshops, diabetes self-management, and chronic pain self-management workshops. So all of those classes are available to older adults. These 3 self-management workshops are also available to younger people with disabilities. And over the course of 6 weeks, participants learn how to evaluate new treatments, talk to their doctors, deal with stress and insomnia. Really, really good programs. And as we have made those available remotely, it's actually allowed us to serve more people. And so if you're from another part of Texas and you have interest in these programs, please let us know. In some cases, we are able to add to our classes people from outside our service area. We also have a brand new program that we launched within the last couple months called Financial Fitness for Older Adults. And we created this program because we had a lot of people coming to us looking for emergency financial assistance. And so we wanted a service that would be helpful to folks beyond, connecting them with a resource to pay their utility bill or their rent one time only. And so through this program, we are able to work with people age 60 and over time, kind of moving at a pace that works for them. And we've got 6 different modules in this program. People can kind of pick and choose the ones that are important to them. And the topics include developing a spending and saving plan, which is kind of another way of saying budget without using that term that kind of scares off a lot of people. Using healthcare insurance, avoiding scams, avoiding unfair loans, Medicaid, and advanced directives. So I mentioned that I would share more information about our direct services. So the first direct service that I'd like to talk about is benefits counseling. Again, this is available statewide. It provides information, referral, and assistance to people age 60 and over, their families. This program can also counsel Medicare beneficiaries of any age. So if there's a 45-year-old who's receiving Medicare benefits, we would be a resource to help that person understand her Medicare benefits, her Medicare options, to help her submit an application for Medicare Savings Program or Medicare Low-Income Subsidy benefits. Benefits counselors also have training in Medicaid, other health insurance, long-term care options, and some of the benefits counselors have been certified to discuss advanced directives as well. So even though they're not attorneys, there's actually a state statute that gives them the authority to discuss the directive to physicians, the healthcare power of attorney, and so on. So if you all are not familiar with the Medicare savings programs, the Medicare low-income subsidies, these are wonderful federal benefits for people on Medicare who have low incomes, limited resources. The Medicare savings programs, depending on the specific program, it can help with the Part B premium. And for those people with the lowest incomes, not only does it help with the Part B premium, where folks would not have that $150 or so deducted from their Social Security check, but it would also help out with their Medicare copays and deductibles. So those benefits can be huge. It's kind of like a federal state funded supplement. Medicare low-income subsidies would provide help with copays for prescription drugs. So nationwide, only about 25% of people who qualify for those benefits receive them. So we always want to let people know that the benefits are out there. through the benefits counseling program, we are happy to screen people to see if they may qualify for the benefit. And we can also help out with the paperwork. That's one of the major reasons why eligible people don't receive the benefits. They don't have the ability to do the paperwork. Through the benefits counseling program, we can also help out with fraud and abuse issues, counsel people about consumer rights. And we also have a little bit of money, and I want to emphasize little, that we can use to actually pay for consultations with attorneys in some cases. And generally, we would do that if somebody needs help in dealing with what we refer to as permanency planning issues, drawing up a will, getting those advanced directives in place. In some cases, we'll also provide funding for consultation on guardianship issues as well. Our care coordination program, again, this is a program that is available statewide, but at our level, we do have some discretion to decide what services we fund through the program. We also have discretion to kind of develop our own screening criteria to determine the duration of services, although this is a program that is intended to provide short-term assistance in all cases. In order to qualify, people do have to be at least 60 years of age. And the services that we've chosen to fund within North Central Texas, and again, these may be a little bit different from one AAA to another, are light housekeeping, as well as personal assistance. We rent emergency response devices. We provide temporary help with prescription drugs. We can pay for medical equipment that's not covered by insurance. And we do a lot of medical equipment for the bathroom in particular, elevated toilet seats, transfer benches, shower chairs, grab bars, handheld shower nozzles. We can also pay for accessibility related home modifications. And so most of the work we do under this category would be wheelchair ramps, grab bars, widening of bathroom doorways. We also will provide one-time assistance with utility bills. And when we received additional stimulus funds, we started funding plug-in appliances. So we'll do window air conditioning units, microwave ovens for folks who may have difficulty using the stove, plug-in refrigerators as well. So again, the specific services, the eligibility criteria may be a little bit different, but the program is definitely statewide. So the eligibility criteria that we use within the 14-county North Central Texas area is to require that folks meet at least 3 of our screening criteria. And those include income at or below the poverty level, a recent hospital stay or nursing home stay. And we generally look for that within the last 2 to 4 weeks. We also give priority to folks who are frail, and we define that as needing help with 2 or more activities of daily living or substantial supervision. The 4th targeting criterion is a diagnosis of Alzheimer's or a related disorder or significant cognitive impairment. And then finally, a lack of family support. So again, folks don't have to meet all of these, but currently we do require that folks meet at least 3 of these in order for us to open up a case and start providing these services. So in the old days, prior to the pandemic, we would provide these services for up to 3 months. Since we have received some additional funds, we have extended the maximum term of service to 5 months from the 3. We also have a similar program, Caregiver Support Coordination, and this provides temporary services up to 5 months to older or disabled people who have unpaid family caregivers. And we can do all of the services that I highlighted on the prior slide. And then we can also authorize respite care as well to give those family caregivers a break. Our targeting criteria are a little bit different for the Caregiver Support Coordination Program. And again, I would just let you know that these are the targeting criteria for North Central Texas only. Other parts of the state would have targeting criteria that would vary. So we give priority to caregivers who have poor health, work disruptions related to their caregiving, those who care for somebody who has no other support, those who care for a person who's been in a hospital or nursing home within the last 2 to 4 weeks, those who care for somebody who has Alzheimer's or needs help with 2 or more activities of daily living, dressing, grooming, toileting, feeding, as well as those who live in the same house as the care receiver. And through the caregiver programs, we have kind of a broader population that we can serve. So we can serve somebody who's at least 55 years old, if that person is caring for a younger relative who has severe disabilities. So if there's a 57-year-old mom who's caring for a 32-year-old daughter with Down syndrome, we potentially could provide caregiver support coordination services, even though neither mom nor daughter is 60 years of age. We can also serve people who are at least 55 years old if they are the grandparent or relative other than the parent who has primary custody of a grandchild under the age of 18. So again, 57-year-old grandparent could receive services through our agency if that grandfather is caring for a grandchild who's 15 years old. We can also provide help to caregivers of any age if they care for somebody who's at least 60. And then we can also provide support to a caregiver of any age if that person is caring for somebody who has Alzheimer's disease or a related disorder. Through the older relatives programs, we can do nearly all of the things that I described under the care coordination program. In addition, we can provide respite vouchers for childcare. We can pay for a consultation with an attorney to establish guardianship over the grandchild. We can provide limited financial help with back to school clothes and supplies. We can also help connect the caregiver with public benefits. There's a one-time benefit for grandparents who are raising grandchildren that's not widely known. Our long-term care ombudsman program, again, those services are available statewide. They advocate for people who are in nursing homes, assisted living facilities. They also help people who are thinking about placement choose the facilities that are best suited to their needs. And then we do some training for nursing home staff members as well. Through caregiver education and training, we provide support to family caregivers. We do educational workshops like today's. We also have an online education resource that I'll show you in just a minute. We are very proud to support the Alzheimer's Association, the North Central Texas chapter, which has a great program called REACH. REACH is a program for family members who are caring for somebody with dementia. And over the course of several months, a dementia specialist will help the family kind of understand the disease process and come up with plans for dealing with difficult behaviors, whether it's anger, aggression, wandering, not wanting to bathe, asking the same question, 57 times a day. So here is a shot of our online resource that I mentioned. It's www.familycaregiversonline.net. Really a great resource that has all kinds of fact sheets, legal forms, online education, lots of resource links. So if you're looking for a cancer support organization or Parkinson's support organization, you can find that information through familycaregiversonline.net. So before I turn to the Aging and Disability Resource Centers, I'd like to share the statewide toll-free number. So if you're in any part of Texas, just call this 1-800-252-9240 and enter your zip code. Your call will be routed to your local area agency on aging. I'm sorry, I have motion sensing lights. And so if I don't move around enough, it gets really dark. And we are open during normal business hours. If you are in the North Central Texas area, I've given you our website address, my email address. I've given you our direct toll-free number, our fax number, and our mailing address as well.
Doni?
Now, yes,
stop for
Marty?
just a minute and answer some
Yes.
questions. Is that all right?
Yes.
I'll ask you some questions here. We've got about 5 or 6 of them. What causes services to vary between centers?
So, you know, the beauty and the curse of the area agencies on aging is that we have the flexibility to respond to local needs. And one of the things that we're required to do is assess the needs of our community and determine what kinds of services we're going to provide. So there's some services that the state mandates, but there's a long list of probably 30, 35 services that the AAA can pick and choose from. And I'll give you a good example. So one of the services that AAAs can support is adult daycare. So if you go down in the valley, you will find an adult daycare center on nearly every street corner. They are readily available. We serve 14 counties, and last I did a survey, there were only 2. So we love adult daycare, but it really doesn't make sense for us to invest in that because we don't have the local providers. So we're really called to look at what does the community need? And in a rural area, the needs are going to be very, very different from those in urban communities. So it's really a process of looking at needs, looking at capacity, and then making decisions that, in our opinion, best meet the needs of the communities that we serve.
Very good. The next question is transportation only for medical appointments?
So I will speak to our transportation program only. So it is a very small program. In our agreements with our providers, we have specified that they give priority to medical. With that said, there are people who need medical, and our funding is just not sufficient to provide all of the trips that are necessary. We tell our providers, give priority to medical. You can do other trips too, as you have capacity. So we're more than happy to pay for somebody to get a trip to the grocery store or to the hospital where their loved one has been admitted. We'll pay for all of it. But again, there are some very real issues in terms of capacity. So that's the priority that we require, but that's not the limitation that we impose.
Very good. Who grants contracts to prepare home delivered meals?
Who grants contracts? So that is,
I'm sorry, to prepare home delivered meals.
Who grants the contracts?
Yes.
Who issues the contracts?
Yes.
So that would be a responsibility of the Area Agency on Aging. And the Area Agency on Aging would have an obligation to go through some kind of competitive process. The AAAs would be on different timelines. Our practice in North Central Texas is to go through that process generally once every 3 to 5 years. But again, that would be a responsibility of the local AAA, and its timeline, its procedures would likely vary.
Right. How can participants sign up for programs?
So we do have an open enrollment system. So anybody can call us. It can be the older person, it can be the family member, it can be a professional. On our website, we actually have all of our referral forms so that if folks want to, fill those out and send them to us, that's great. We don't require it. So we work with as much or as little information as we get. People can call us, they can fax us referrals, they can email us. We will follow up on all of them.
Very good. I've got three more. What are the activities of daily living?
Activities of daily living would be tasks like transferring from a bed to a chair or from a wheelchair to standing up, bathing, toileting, grooming, feeding. So really those very basic personal care tasks.
How are area needs determined?
So area needs are determined in many ways. So every 2 to 5 years, we are required to develop strategic plans, and the state usually provides us really clear guidance about the things that we need to do. So we're required to get input from the community. In some cases, that's surveying. In some cases, that's holding public hearings. In some cases, that's talking with members of our advisory committee. It may involve other types of activities as well. So the expectation is that we would make a really concerted effort as we're developing that strategic plan. But if we're doing our job right, we should be listening to our community every day. So I'm always interested in hearing from folks, what are the needs of older adults, family caregivers? You know, maybe there's a way that we can support that, even if it's not something that we have funding to put behind. You know, maybe there are ways that we can join with other local providers in order to come up with a creative solution. So the strategic planning shouldn't be something that we just do once every few years and then forget about it. It really should be ongoing. But again, there's a very structured process as we're developing those strategic plans.
Good. One last question. Is there a vegetarian option for the meal delivery service? So
in North Central Texas, we work through 12 different provider agencies, and the capacity does vary quite a bit. So the providers can develop special menus. It's generally much more expensive to do that because there are a lot of nutritional requirements. A dietitian has to review, approve all the menus. So unfortunately, I'm aware of only one provider in North Central Texas that serves a 3-county area that has the ability to provide vegetarian meals on an ongoing basis. Others may have the ability to do that, and I may not be aware.
That's it. Thank you.
Okay, very good. So I definitely want to get to the Aging and Disability Resource Centers. So let me go ahead and dive into that information. So as I mentioned, the Aging and Disability Resource Centers are available statewide. We're very indebted to Texas Health and Human Services Commission that has provided state funding for these programs. And they assist people of all ages, all types of disabilities, and their family caregivers. So with area agencies on aging, we're generally looking at people who are at least 60 years of age, no age requirements, no income requirements for the ADRC. The purpose of the program is to help people find and access long-term services and supports like attendance services, respite care. We talk with folks about medical transportation, residential repair, Medicaid waiver services. Through the ADRC, we also help people apply for public benefits such as Medicaid, SNAP, which used to be called food stamps, the Medicare savings programs, and other benefits as well. Free cell phones through the state of Texas for people with low incomes. One of the direct services, and initially the ADRC was not designed to provide direct services. It really was to provide that connection to other agencies, to kind of serve as a one-stop shop for people who may need those long-term services and supports. And the vision was that we would be knowledgeable about other federal, state programs, as well as the local programs that we would screen, and that we would make qualified referrals. So over the years, we've expanded, which is really exciting. and am delighted that all of the ADRCs now have a respite care program. May look a little bit different from region to region. In North Central Texas, we issue respite vouchers to caregivers, and they can use those vouchers to pay for a short-term stay in a nursing home. They can pay for a family member to come in and relieve them. They can be used for day camp for children with special needs. We support therapeutic writing camps for people with physical disabilities, as well as intellectual and developmental disabilities. So the respite program provides short-term assistance to unpaid family members who need a break, aren't receiving respite services, and can't afford to pay privately. So we also have a respite benefit through our area agency on aging. When folks call in, they need respite. Again, we're screening. We're figuring out, does this person qualify for AAA services? If they don't qualify for AAA services, then at that point, we would screen them for ADRC respite. The ADRC also offers options counseling, and that's a program that helps nursing home residents without Medicaid to identify and access community-based services. So in most cases, we're working with people who've been in facilities under their Medicare benefits. They've improved, but they're not necessarily to the point where they're independent, and they are looking for help in terms of getting some services in their home. So again, we're screening them to see if they qualify for AAA services. Can we build them a wheelchair ramp? Can we pay for respite or personal assistance? Seeing if they would qualify for financial assistance through the AAA. And then we're also screening them to see if they may qualify for programs through the state, such as the Community Attendant Services Program. We talk with folks about STAR Plus waiver services and help them understand the eligibility criteria for those services as well. We also offer housing navigation services, and this is a service that's administrative in nature. It doesn't go out and help people find apartments, but it does compile inventories of affordable housing. And Marty Mascari, who coordinated today's event, actually serves in at least a couple of roles with our agency. He also serves as our housing navigator. So for those of you who are in North Central Texas, I've provided you a link to that housing inventory. But if you're in another part of the state, you can just call your Aging and Disability Resource Center, and they should be able to provide you an inventory of subsidized housing. The Housing Navigation Program also advocates for the expansion of affordable housing as well. And I will tell you that, no matter how long the inventory is, that doesn't necessarily mean that when the person calls and says, I've got to find a subsidized apartment, tomorrow or next week, or even in a few months, that it's going to be available. We find that there are extremely lengthy wait lists for nearly all of the housing programs. And that's kind of a frustration to our callers and a frustration to us as well. We really want to be helpful, but oftentimes we're just dealing with very, very scarce resources. So here's the contact information for the Aging and Disability Resource Centers, 1-855-937-2372, which is also Yes ADRC. Call that number, enter your zip code. You would be routed to your local Aging and Disability Resource Center. We are open during normal business hours. And then I've provided contact information for our ADRC as well. So we have a website at nctadrc.org. We have a fax number that is specific to that program. So it looks like I have just a few minutes left. So Marty, if you want to go over the CEU information, and if you have any questions, I'll be happy to try to answer those.
Okay, I'll go with the CEU information first. There's one question. Once again, for those of you interested in obtaining CEUs for today's presentation. We're offering CEUs for licensed professional counselors and licensed social workers in the state of Texas. Once again, I know we get people that join us that are licensed in other states. We're not set up to provide their CEUs for them, but I've had people in the past tell me that they've been accepted by some, but that is specifically with whoever makes the decision on their part. We don't have any control over that, but that's up to you. They're free of charge. We're offering 1 hour's CEUs credits today. You must have completed this entire live webinar. You must complete the Google survey evaluation that will be sent out to you here in about an hour with their first follow-up email. The Google survey evaluation will stay live until 5 p.m. on Friday, 5 p.m. Central Time on Friday, and then certificates will be emailed out to you by next Friday, the 8th. The other thing I wanted, and it was asked by somebody, we record these. Anybody that was registered today for this presentation will receive a link to the YouTube recording for this presentation. That'll be up in approximately a week. I'm a little bit behind on those because I missed some time, but we're getting caught up on those. But you should have those within a week sent to you in a second follow-up email we send out after this webinar. Doni, are you aware of any programs that help pay for wheelchair accessible vans or modifications?
Yeah, and you know, we get a lot of calls. I won't say huge numbers of calls, but the only resource that we've been able to identify is through the independent living program that used to be administered by DARS, the Department of Assistive and Rehabilitative Services. Those programs have transferred over to the Centers for Independent Living. So again, the name of the program is Independent Living through the Centers for Independent Living. There is a pretty lengthy wait list for that program. Again, much more demand than resources, but it's really the only one that I've been able to find to that could potentially consider that type of modification. And we also get requests for staircase lifts for people who live in two-story homes and, you know, it's no longer safe for them to climb the stairs. You know, that's another another modification that potentially could be considered through the independent living program.
As a follow-up to that, somebody just popped up with a question about the wheelchair carriers on the back of vehicles. Does the funding pay for that?
Yeah, so again, to my knowledge, the independent living program would consider that, you know, no guarantees. So, you know, there would be a caseworker assigned. I'm not sure what the, if there's a dollar limit on the plan of care. And certainly the, you know, the modified vans would be very pricey. I think the last time we looked, it was like $25,000. So I would say that would really be a stretch. I think the, you know, the lifts on the back would be much more affordable and, you know, more likely to be considered within that program. But again, that's where I would suggest that folks call is their Center for Independent Living. They would administer the program and they would be able to provide better information about, you know, eligibility, timeline, scope of work.
I might add that Jennifer Thompson just put it in the chat about Texas rehabilitation. I'm sorry, Texas Workforce Solutions and the Vocational Rehabilitation Services. You might want to read that. She talks
absolutely, yeah, and that's a really important distinction. So for folks who have a goal of gainful employment, there are a whole lot more supports and they are more timely available. So the independent living program is really for those folks who don't have a an employment goal. But again, with an employment goal through Texas Workforce Solutions, there tend to be more funds available and kind of greater flexibility.
Very good. Someone asked, if someone is 60 plus, would it be best for them to go through AAA or ADRC for assistance, such as personal care for someone in Johnson County?
Yeah, so in Johnson County, the ADRC and the AAA, we're sitting in offices next to each other, and a lot of times we're answering both phones. So the vision is it really doesn't matter. So, you know, we tend to refer folks to the ADRC first because our AAA staff, they're going to be working on AAA services only. And if folks don't meet our screening criteria for care coordination, we wouldn't be able to provide the service. If somebody calls the ADRC, you should get somebody who's really knowledgeable about community attendance services and STAR Plus waiver. And so I would advise starting with the ADRC so that the person who takes that call is in the habit of not just thinking AAA only, but thinking about other federal services, other state services, and would be knowledgeable about AAA services as well. Again, a call to either number should get you where you need to go, but I'd advise the ADRC.
One last person posted about the web address for the ADRC. And in the first one, I just want to point out there's an extra R after the NTC. It should be ADRC, not ARDRC. And okay. I'm throwing that out. I don't know where they got that from, so I just want to point that out. The www should work either way, with or without, but there's an extra R in the first one. So, but hopefully you all get there. That's all I have for questions, Doni. Okay. Unless you have something else you want to add.
No.
Thank you, Doni, for a great presentation. Thank you all for joining us. We sincerely appreciate it. We've got 2 more webinars this week, one tomorrow and one Thursday. I will send out links to the flyers with the follow-up email after today's presentation. Please don't forget about filling out your survey. The survey must be filled out by Friday in order to be eligible for your CEUs. Once again, thanks y'all for joining us, and y'all have a great day.